This is the Negotiating the New Normal session with Delia Williams Gunpot. And Delia is a fellow with Research Group on Disparities in Health at Columbia University. She's also a consultant and entrepreneur based in Brooklyn, New York. In many places around the world, the current coronavirus pandemic has affected the health of people of colour at a vastly disproportionate rate. So how much has that helped reveal about how racism determines health outcomes? With over 15 years' experience in the field of health, Delia is here to declare racism as a public health crisis. And after she's given her plenary talk, we'll be taking your questions and comments, so please do submit them underneath the video you're watching. So over to you, Delia.
Thank you, Adam. Right. So let's just get right into it. If Black Americans were dying at the same rate from COVID-19 as our white brothers and sisters, about 21,000 Black Americans would still be alive. That's like 21,000 mothers, grandmothers, fathers, grandfathers, just lots of love. That's just gone. And it's never going to come back, right? The reality is that 1 in 1,020 Black Americans have died so far. I mean, as of September 15, this is when this data is most current, have died from COVID-19. And when we look at the rates in white Americans, it's 1 in 2,150. So when we compare the death rates to Africans on the continent, we can see that there's a wide disparity because Africa accounts for like 17% of the global population, but only 3.5% of the reported global COVID-19 death rates. In the United States, where I live, it is African Americans, Latinos, and Indigenous people who have seen the highest death rates. While in the UK, right, the groups that are Black, Asian, and minority ethnic groups, they have experienced the highest death rates. What is striking about COVID-19 death rates is the familiarity in the patterns. Anyone who has been working in public health or health disparities, we've seen it all before. In fact, what we are seeing is the same traditionally marginalized population groups overrepresented in COVID-19 deaths. So one can ask the question, is this because of their race that makes them more susceptible? Or is it because of racism meted out against these various groups that increases their risk of dying from COVID-19? The evidence, unfortunately, seems to suggest that racism practiced against these groups are leading to unequal health outcomes. In an official inquiry from Public Health England, it concluded that racism and discrimination suffered by Britain's Black, Asian, and minority ethnic people has contributed to high death rates from COVID-19 in those communities. And I quote also, the report says that racism and discrimination experienced by Black, Asian, and minority key workers is a root cause affecting health and exposure risk for these communities. Racism is a form of systemic oppression. And what it does, it targets members of the designated outgroup in various societies. The thing about racism and systems of oppression, it has long been recognized as an actual threat to civilization. I mean, one just has to look at Nazi Germany in World War II and the rise of anti-Semitism, and it literally almost destroyed Europe and the world as we knew it then. So post that, the UN Convention under the Human Rights Charter of 1965, the International Convention on the Elimination of all forms of racial discrimination, declared any doctrine of superiority based on racial differentiation is scientifically false, morally condemnable, socially unjust, and dangerous. And there's no justification for racial discrimination in theory or in practice. But like far too many UN conventions, they represent an idealized version of ideas. Since this convention passed in 1965, there have been numerous instances of war and death linked to one's racial or ethnic affiliation. You just have to look at the war in Rwanda between the Hutus and the Tutsis, and even the Bosnian conflict in Europe. These examples underscore that one's race or ethnicity, due to the practice of systemic oppression, can increase your probability of death or injury. So when we look at COVID-19, we see that systems of oppression are in fact antecedents of health inequity and disparities. In African American communities, in the US, traditionally the story has been told that, African Americans, they're more susceptible to diabetes, heart disease, strokes, obesity. And this was often attributed to, race. It's because they're African Americans. But over the last few years, there has been a shift, and there's a greater recognition that it is in fact racism that is experienced by these groups that are creating these health disparities. And, you may or may not know, but racism is as American as apple pie. Racism in the US is the system of oppression that may be a driver of poor health outcomes in African Americans. So I want to take some time here and just give a definition of racism, because racism is not just one thing, it's like multi-level. So we have something that is called institutional racism or structural racism. And this is basically societal systems and institutional policies that produce racially biased results. For example, if you're doing an exam, right? And part of the exam is oral and part of it is written. And people who are left-handed do much better at the oral exam as compared to people who are right-handed who do better in the written part of the exam. But you weigh the exam in a way that the oral part of the exam carries more marks, right? So you in fact bias the exam for left-handed people. So this is how the institution has policies that can produce racially biased results. And then we also look at personally mediated racism, which I feel most people are familiar with. So this is where individual members interact with members of a group or ethnicity with biases. So that's like your racial slurs and that kind of thing. Then we have internalized racism. This is where members of a racially stigmatized group, they accept that negative messages that the dominant culture is putting out about them. And what is particularly dangerous is when you have a combination of either the structural systemic racism with personally mediated racism. So you have that power structure behind that person who is biased or racist towards a particular ethnicity. Or you even have, when you have the power connection with internalized racism. So you have someone who, even though they may be a member of the so-called out group, they have internalized racism, so they carry the same ideas against the racial groups and use the power that they have within the institutions to create a racially biased environment, even though they are of the same race. So African Americans go about their daily lives encountering these different types of racism. So there is a growing consensus that systemic oppression in the form of anti-Black racism represents a threat to the health of Black Americans. This recognition and the disproportionate amount of deaths among African Americans from COVID-19 has underscored this demand that racism be declared a public health emergency. And with that, we understand that racism faced by minorities really act as a permanent stressor in their lives. Now, the human body is an amazing thing, and we have a natural stress response system to deal with acute or short-term stress. This is called the HPA axis. When we are exposed to chronic or long-term stressors, this system fails to work as designed. And what happens is that an HPA axis abnormality develops. And this develops due to frequently repeated or chronic environmental stress. And chronic stress, what it does, it alters the biological responses in a manner that increases risk for chronic diseases and also increases cortisol levels and thereby causing HPA axis dysfunction or abnormalities. And the diseases that are linked to this HPA axis dysfunction: cardiovascular diseases, diabetes, stroke, obesity, all diseases that are markers of health disparities in African American populations. Again, we see that racism faced by minorities act as a persistent stressor in their lives. Chronic psychological stress has been associated with the onset and the progression of chronic inflammatory diseases. COVID-19, by and large, is an inflammatory disease. Dealing with racism in all its varied forms is literally making African Americans sick. Now, we often hear, if African Americans would just do what they have to do, get educated, it would be all right. So education is just like a panacea for all levels of discrimination. The truth is, having a PhD does not change one's phenotype. When we look at maternal and infant mortality rates in the US, we see that a Black college-educated woman and her baby are more likely to die in childbirth than a white woman with just a high school education. Additionally, in the workplace, often paid less than their white counterparts, even though they might be more educated. These create a persistent stressor. Additionally, African Americans working in predominantly white spaces often experience microaggressions in the workplace. Even when African Americans interact with direct healthcare services, they often have disparate outcomes when compared to their white counterparts. A study came out recently, maybe a couple of years ago, where doctors actually believe, these are practitioners in the field, that African Americans had a different pain threshold. The result of these experiences of racism are inequalities, which become persistent. And what it results in accumulated disadvantage over time, or something known as the weathering effect. So this weathering is the result of chronic exposure to social and economic disadvantages that leads to the acceleration of normal aging and earlier onset of unfavorable physical health conditions among disadvantaged people. Again, we see the declaration of racism as a public health emergency is warranted. So, okay, we have declared it a public health emergency. What's next? How do we negotiate the new normal with the understanding that racism is a public health emergency? How do we deal with the impacts of this racism going forward? Our goal is to create health equity. Health equity is the assurance of the conditions for the optimal health of all people. And we do this by focusing on structural racism, which is essential to advance health equity and improve health for all. We look at the systemic issues, and we agree that they must be addressed by policy changes, and also creating new legal precedents that addresses racist practices and policies. When we look at personally mediated racism, we believe it is a result of stories that have been told that paints a narrative that is not based in truth. So we need to reshape these narratives and create a new narrative that is based on historical truth. When it comes to individuals from marginalized groups who have internalized these racial stereotypes, we believe the answer might be self-love, and they must take on a positive view of their personal racial identity. And in closing, I just want to add that all of this must be done in a spirit of love and understanding that underscores the interconnectedness of life as we seek to create a world where we all can breathe. Thank you.
Thank you, Delia.
Yes.
How does it feel to talk about that, first of all?
It feels empowering because I think it's an important discussion. And I think far too often it's in the halls of academia. And we need to allow people to understand the impact of persistent stressors on the lives of African Americans.
Well, for the people who are watching this out there, we do have a couple of minutes for your comments and questions, so you can just leave a comment underneath the video that you're watching here, and Delia may have time to respond to it. When we're passionate about a cause, it's often linked to something that's happened in our own lives. Is there an example regarding public health that you're willing to talk about of where the health of someone that you care about a lot has been adversely affected by racism that has contributed to your drive to make your declaration today?
Okay, so the thing about me is that I migrated to the US. So I'm like, not even first generation, I'm an immigrant. And what the data shows is that, you know, I have all the traditions and the belief systems, and I am yet to be impacted by health so much by these systemic issues. It is my children who will be impacted, and my grandchildren. So when we look at maternal mortality rates, immigrants have the same rates as white Americans, or even better. But their children, by the time they have children, they have the same high risk of dying, or their children dying, as African Americans. So it's within one generation and growing up with these persistent stressors that it starts to impact the overall health of African Americans or new immigrants who fall into that category.
So you've been involved in the health sphere for around 15 years, over 15 years. And when it comes to the impact of race on health outcomes, have you
I just lost you. Can you repeat?
Yeah, sorry. So I was just saying, you've been in the health sector for over 15 years. I just wonder if you can tell us if things have got better or worse, or what kind of trajectory we're on.
I think the recognition now that, because when I first started, it was always these health outcomes were because of one's race. So it was a susceptibility issue because of. And now that shift, as I mentioned, where we are recognizing that it's really the racism that is creating these outcomes. Because when you look, as I mentioned earlier, when you look at COVID-19 and death rates on the continent of Africa as compared to the US, African ancestry, the variance is so wide, right? And if it was a matter of genetic predisposition, it would be quite similar. So the data is definitely showing that it is the living conditions, the chronic stressors that African Americans face. And you know, it's not only in the US, even in the UK, where we have these Black, Asian, and minority ethnic groups, because they are now exposed to racism, they are having the same health outcomes as African Americans in the US. So just racism is just a persistent stressor that really impacts health outcomes. And I think the recognition of that is how we negotiate the new normal, right? We cannot negotiate the new normal unless we recognize what that is. Yeah.
That's opened up a lot of conversations around race in many different areas of life. Have you found that it sparked overdue conversations within the sphere of public health about the role that racism plays?
I didn't really catch your first part.
Yeah, I was just noting that George Floyd's murder, the subsequent increase in the impetus behind the movement for Black Lives Matter, a lot of conversations around race in many areas of life. I just wonder about within the public health sphere, whether conversations that are overdue have been sparked about what kind of role that racism plays in public health.
I think in terms of public health and academia and you know, those who practice this as a scholarship, this conversation has been happening. There's tons of research on social determinants of health. It has been recognized, but it hasn't been in the mainstream. I think George Floyd's death just really put a spotlight and allowed for so many different conversations around racism and its impact. So now people are looking at racism and housing and redlining and the fact that historically stories have not been told in truth. So they create a distorted version that doesn't reflect the reality of the experience of African Americans. So just a number of conversations came up because of George Floyd's death.
When you talked about racism in relation to public health, what kind of resistance have you faced?
I think the biggest resistance, it's the blame the victim mentality. You know, as I mentioned, it's like if they would just do the right thing, then they would be all right, you know? And this whole idea of, look at me, I did it, so why can't they? Right? This whole exceptionalism kind of thing. That is the biggest resistance, not recognizing that it's systemic, right? And if you are an outlier and you were able to escape the system, you are not an indication of what's happening throughout. You are not the norm. We have to look at the middle of the bell curve, as I always say, when we make decisions about public health. You don't look at the outliers on either sides to decide policy. And I think by and large, that has happened.
And for healthcare professionals out there, what is your call to them?
Just recognize that racism is a permanent stressor. And one, if you are in an institution, what are the policies and practices that perpetuate that? What are your belief systems? Just practicing cultural humility, recognizing that I could never really understand what it is to be someone who's oppressed, right? And just be willing to hear their story and listen when someone from another race talks. I mean, the story of Serena Williams comes up, where Serena Williams has all the money in the world, is super rich, is having her baby, recognizing that something is wrong, telling her doctor something is wrong, and they are not listening to her. I think it's only when her husband intervened that they did another check and they realized that she had a blood clot. So we, you know, in the healthcare field, we have to listen to our clients who may come from different racial groups and hear their voices, really hear them.
Well, we've really heard yours today. Thank you so much for sharing your thoughts and for making your declaration, which is vitally important. We've been really lucky to actually edge over into the next allotted time period for the next session. So we've been able to have a bit of a Q&A, which has been nice. But we're going to be hearing from Renee Cummings next. That's scheduled to come with algorithmic justice. That's the topic that she'll be discussing with me next. But for now, Delia, thank you very much for negotiating the new normal with me.
Thank you.